Okay, I'm going to demonstrate accessing a portacath. So first I'm going to enter the patient's room. Knock, knock, Mrs. Smith. How are you today?
I'm just fine.
Well, my name's Jewel. I'm your nurse, and we're going to access your port, if that's okay. I have a doctor's order here that says to access your port, and we'll use that to give your IV antibiotics, okay?
Okay.
Let me check your ID here. Can you tell me your name, first and last?
It's Jane Smith.
And what's your date of birth, Miss Smith?
October 15th of 1975.
Okay, thank you. I'm going to wash my hands. Okay, and then the first thing I want to do after I've washed my hands is to verify that I can find the patient's port, okay, before I get all gloved up. So I can see hers right here. It's pretty prominent, but I'm just going to feel, make sure hers is just a single port. Sometimes there's doubles, but that way I know exactly where I'm sticking before I get my gloves on. Sometimes you have to reposition your patient to get the port to stand out better. So this is a sterile procedure, Mrs. Smith, so I'm going to get my equipment ready, and then I'll help you get positioned, and we'll get this done. Okay, so my equipment, I have a central line dressing change kit. I have a 12 cc syringe, and it's important that you use the correct syringe according to your facility's protocol. Some may be 5, some may be 12. But you definitely don't want to use anything less than a 5 just because of the increased pressure, and it's a central line. I have a needle and a syringe and saline to draw up my flush. Many facilities will have pre-filled syringes, but since I don't, I'm going to have to draw my flush up. I have alcohol swabs, I have a J-loop, and I have a Huber non-coring needle. So I'm going to pull the curtain and make sure that my patient has privacy. Okay. So the first thing I'm going to do is open up my equipment, making sure that I keep a sterile field. So I'm going to be peeling this back and making this my sterile field. I'm going to open up my J-loop, and for now I'm going to leave it right in its sterile package. Same with my Huber needle, I'm leaving it in its sterile package. My 12 cc syringe and my needle, and I'm going to dump my needle in here so I can access it very quickly. And I'll open my alcohol swabs. And I'm going to open my saline, and I'm going to swab this off with one, and then I'm going to put an alcohol swab on there, and you'll see why in just a moment. And this is my sterile gloves. I'm going to get those ready. And some kits may have one, some kits may have 2 masks. If you have 2, you're going to put one on the patient. And you really should put one on your patient, even if you have to go hunt one up, just because you don't want them breathing on their port site. So I'm going to ask you, Mrs. Smith, if you could turn your head this way. I don't want you breathing on your port site, and if you could put this mask on just to help us not get that infected. Okay, so I'm ready. My patient's positioned. I'm going to put my sterile gloves on. Okay. First thing I'm going to do is draw up my flush. Okay, so this is sterile, I'm sterile, my needle is sterile. And this is why I put the alcohol on there. If you have a partner to help you, they could hold the saline bottle for you, but if you're by yourself, this is the only way I found to draw up saline and stay sterile. Okay, and then I'm going to use the scoop method to recap my needle. If I don't have and it's very important with central lines to get all the air bubbles out. We do not want to inject any air. And I'm going to go ahead and attach this to my J-loop and flush it. And one thing that's different with my central lines rather than the peripheral lines is I want to clamp my tubing. Anytime you connect and disconnect from your central line port, you want that clamped just to prevent any air bubbles from getting in. So I'm going to go ahead and take that off. I'm going to lay this on my sterile field here so that it's easily accessed when I'm ready for it. And I'm going to do one more step, and I'm going to go ahead and prime my Huber needle. So these are special needles, non-coring Huber needles that are used only for ports. So I'm going to prime that. Take this cap off, and this will connect right onto my J-loop. So I have to unclamp, and I'm just going to prime that. Wouldn't squirt it on my patient. And again, I'm clamping. So you see there's two clamps here, and there's only one, you only have to clamp one. I've still got a couple air bubbles, so I want to get those out. Okay. So I'm clamped. I'm going to leave my needle right there, ready for me to grab and insert. Okay, so my patient's head is turned away from the site. ChlorPrep is what is used in most central line kits anymore. I'm not going to activate it because it's hard on the mannequin, but you would squeeze these handles and wait for the sponge to get wet. So I've squeezed my handles, I have ChlorPrep. Ms. Smith, I'm going to just clean your site, and I'm going to time 30 seconds. I am going to scrub, and that time may differ per hospital protocol. But I've got my watch on, and this back and forth scrubbing motion is what kills the germs with ChlorPrep. Okay, so that's 30 seconds. And this goes in the trash. And it's important to let that air dry. I don't want to fan it, and I don't want to wipe it. It's part of the sterilizing process is to let that air dry. So I'm waiting for it to air dry. Once it is not shiny, I can see that it's dry. I'm going to grab my Huber needle like so, and I like to keep this in my fingers so it's not dragging on the patient's unsterile chest wall. Okay, and I'm going to position. I'm still sterile so I can touch. Okay, Mrs. Smith, you're going to feel a small stick. 1, 2, 3, straight in. And that is going to keep that pretty firm so I don't have to hold on to it. And before I do anything, I aspirate back and I get blood so I know that I am in. If I did not get blood, I would not flush. So I flush. I've got blood return so I can flush. I'm going to keep my saline syringe upright like this so that the chances of air going in is minimal. So it's flushing easily, no resistance. And I'm not going to flush completely everything because I don't want that air to go in. So as I flush, I clamp that off. Every time you connect and disconnect from this hub, you have to keep a clamp on, just safety. So disconnect, I grab my op site, and I cover that with an op site. Of course, I want to make sure that this clamp is outside of my op site. And then once I've got my site covered, I'm no longer sterile. I don't have to stay sterile. This would be clear, you could see through it, and I would coil this around and tape it however I wanted to. Okay, thank you.